Foreigners here in Vegas. Okay. All right.
All right, welcome everyone to Upstream Intelligence, where Victoria and I talk about upstream thinking and how did we get here today, and where did that come from? How far upstream do we have to go before we can really get to the root cause of some of these problems? And today we are having a special guest, Lancette Van Gilder, and she is going to kind of give us some insights into what naughtiness has been going on in clinical dental hygiene. Not even that, just industry-wide problems between organized dentistry and what they're expecting from hygienists by telling, legislators that there's a shortage. And Victoria and I are going to be talking about what we see as maybe solutions to that, and some other kind of, topics along these lines. So let's have Lancette do a little introduction for herself first, and then Victoria will go into some of the things that you were just talking about before I hit actual record.
Shirley, why don't you introduce yourself? I'll introduce myself, and then Lancette can have the stage.
Okay, that works too. So we're still super loose around here. So my name is Shirley Gutkowski. I'm the owner right now of Primal Air, and we practice myofunctional therapy of the oral cavity, the snoring complex, to help harmonize those muscles. I use my education as a clinical dental hygienist and my envelope pushing skills and my, oh my gosh, this can't be right kind of attitude, and looking for different ways to solve some of the problems that we've got facing us today.
And my name is Victoria DaCosta. I'm also a dental hygienist. My experience is 25 years of clinical dental hygienist, and now the last 15 years of non-clinical dental hygienist practicing. And what was that? We'll talk about it. And I reinvented my education going into dental medical thermography infrared imaging. And what we're looking at mainly is dental posture irregulation correlated with medical posture irregulation. Shirley's work is tandem and synergizes with what we pick up on infrared imaging, the hotspots in the neurology damaging that's breaking down the body, all due to malocclusion. And my whole focus is on point it out, create the reports so that we can now have a bridge between the dental and the medical communities. Just so happens I met a surgeon last night at a networking event I was at that was about 200 people. Medical doctor surgeon, she admitted with 12 years of training, she said, I don't know anything about the mouth. And she's cutting open organs and hearts and livers and kidneys, and she knows nothing about dentistry. And that is my intro.
Well, I am extremely honored to be here. I am Lancette Van Gilder. I am a practicing dental hygienist in Nevada, about 30 years, I guess, practicing. But my passion for alternative ways of thinking actually was ingrained in me as a dental hygiene student. I graduated from the University of South Dakota, and way back then, 30 years ago, most of my training was in interprofessional practice. I worked on Indian reservations. I worked at the Mayo Clinic among a whole healthcare team with pharmacists and physical therapists. And so I had a rude awakening when I actually got out into private practice and realized that that was not the norm, because that's all that I had known, is that dental hygienists were independent. We were smart. We were capable. We could provide a lot of very specialized care in a lot of different settings with a lot of different people. So my kind of commitment to my profession to changing that started 30 years ago. I've been involved in public policy making. I've been a registered lobbyist. I've changed a lot of laws in Nevada. I've worked in Washington, D.C. To really bridge this medical dental divide, so I can see why we're all on this call together. I found out very early on that there was so many things in organized dentistry in the system that weren't serving the public and weren't serving me as a dental hygienist. And so I've kind of gone on a mission to change those things. As far as my work life, it's different every single day. I own a CE company. I'm an international speaker. I coach and consult with a lot of medical and dental practices on bridging the medical dental divide. I'm a practicing hygienist 1 day a week. I own an independent mobile dental hygiene practice in Nevada, and I serve as a clinical director at a sleep, airway, and wellness center that's really focused on sleep disordered breathing from an oral health practitioner kind of model. We work with ENTs and pulmonologists and cardiologists, but our team is dentists, hygienists, and myofunctional therapists.
Super.
Great, yeah.
So that sounds amazing. And I'm just wondering how you even find time to sleep, and is your sleep pretty good? And
sleep is a priority, yes, for me.
Yeah,
yes.
I do too. I'm like, dude, no, it's 8 o'clock. I'm not starting something. I'm going to start getting ready for bed. And sleep is really critical to future thought. You can't do all the things that you're doing right now if you can't sleep. So that's a really important part of all of this, I think. So the lobbyist thing is really interesting to me. Did you say you used to be a lobbyist, or you still are a registered lobbyist?
I'm on a pause from that right now. I didn't mention that I'm the incoming president of the American Dental Hygienists Association. So in this role as president-elect and president, that's on pause for right now. However, during the recent issue that came up in Nevada, I was down in the state capitol in Carson City working on this tirelessly. So I did put my registered lobbyist hat on hold just for a couple of years for my presidency, but still very actively involved in legislation at a necessity.
So tell us exactly what's going on, because it's a little bit confusing. And, we're hoping to attract not just dental hygienists to these episodes, but to the interested consumer and to medicine, to help them understand what role dental hygienists could really be playing in their practices, and what we really know and what they think we know. So
well, let me just interject. I had an event yesterday, 4 hours in a lobby, like we were not lobby, but networking, a lot of businesses, and I put on my name tag RDH. People asked me half the time, what does RDH mean? The public. So we have a critical role right now, or responsibility, to educate the public of the identity of a dental hygienist. I was also asked by another client, well, what's the difference between a dental assistant and a hygienist? Aren't they the same? This is someone who goes to the dental office for their hygiene visits every 6 months. Where did the breakdown in communication come from the dental hygienist is my wonder, So really identifying, where's the ID? When people say medical doctor, or they know right away. Dentist, they know. Dental hygienist, a little fuzzy. So how do we get our name really right there with the team? We're a receiver. We're right there catching those passes from the quarterback, and we're vital to getting to the goal. So I realize now more than ever, we need better in our advertising, in our Instagrams or something, to identify who we are and how educated we are.
Well, I think that is one wheel in a big spoke, one spoke in a big wheel. I have a different perspective on that. My patients know exactly what a dental hygienist is, and they know exactly what the difference is between a tech and a hygienist. My senators, my assemblymen and women, they know, because I have been there. I have been there for 30 years, educating them and telling them. So while we have a chunk of the population that maybe doesn't know or doesn't value us, there is also a huge chunk that does. So, in Nevada, with our legislative efforts, the public is very well aware, oftentimes, what a hygienist is. Like, the public is where we need to spend some time and energy and focus. But there's a lot of other areas that I think are really worth investing in and spending time in and creating change, because the public ultimately does not drive change. We would love for that to happen. But if we look at any social issue, right, the public has a say in it, but it's policymakers, it is lawmakers, it is associations, it's lobbyists. There's a whole group of people those are the people that really need to be educated, right? It's the decision makers need to be educated. So like right now, I think I maybe have an 8-month wait list to see me at my practice. My patients do not cancel. They will not see anybody else. And they've been getting these conversations, these sleep apnea, disordered breathing, tongue ties, A1C testing, blood pressure conversations. They've been getting all those. They know exactly what a dental hygienist does. So, I think some of the onus needs to go back to hygienists. Yeah, we're pretty humble, hard workers, and we are not great at sharing our story. So, Victoria, I think you're spot on that we need to be better about sharing our story, better about highlighting our skills and expertise. But I think it starts with just the patients in our chair, right? Everyday patients in our chair. And we have to kind of call out our fellow professionals that aren't doing that. And I don't know a really tactful way of saying that, except for podcasts, things like this, live streams, blogs, webinars, conferences. We got to start having some uncomfortable conversations that hygienists themselves have created some of the problem that we're seeing, right? We have to step in and own our profession. Yes, educating the public is important, and we need some work there. But the true decision makers, the policy makers, the dental boards, if we want to really change the practice of dental hygiene, that's really where it happens.
So you're saying from the top down, not from the bottom up.
I'm saying both. I think
Okay.
I think I've just been hearing a lot of kind of chatter about certain things that I think are distracting from a bigger picture.
Well,
A lot of comments about like a PR campaign, a lot of comments about reimbursement, a lot of comments about Nevada. Like these are all important issues, but if we're not putting them all together
right.
on a big wheel, we're missing the big picture. They're all critically important.
Right. And Lancet, I agree. When I'm in the trenches with Shirley, all I hear is production, production, production by the dentists and their overhead. The policymakers' conversation really never comes up about the role of a hygienist and what she's allowed to do and what she's not allowed to do. Because Shirley and I are clearly consultants that can come in and increase their business, almost $100,000 a year.
Yeah,
But
easy.
because we look at the dental hygienist as a spoke in the wheel, and this spoke is turned for 50 years the same way, why change it? So then the hygienist is threatened because she has to change, she has to learn something and add, and how's her schedule going to work? So I'm in the trenches hearing this for 15 years. Where's the money? How can we make money changing? And so where I hear it, and I sell an all-natural prophy paste and an all-natural toothpaste, when consumers come in, they ask and request for this special paste, the dentist buys it. So the consumer has a lot of power because they're the money wallet for the purchasing of the services in these practices that the dentist listens to. He won't listen to Shirley and I. He'll listen to his customer, and I've seen that time and time again, right, Shirley?
Yeah.
It's like, well, and even with this surgeon, she was talking about, she saw what we were doing and she was amazed and impressed, but her overall concern was, she still has to make her money. She still wants to, drive her expensive car and everything. So I'm looking at the going, okay, so money is a driver. I love the policies. It would give us the freedom, but the consumers, I think there's more of them than the policymakers.
Well, I'm glad you said that, because when I look at what is needed in our profession, dental hygiene profession, it's like we keep trying to fit like a square peg in a round hole. The
Right.
system has to change. The fact that we are still in a system where a dentist gets to decide all these things and the hygienist, doesn't have influence and doesn't have, skin in the game. And that whole model is the problem. That is the exact problem, right? So there's, I think, a tremendous opportunity when we look at workforce shortage, this crisis that everyone's like, oh, the sky is falling. It is not. We have a very outdated model of care. And until we start to change that, when I look at what is needed to get people healthy, it's like foster the innovative, brilliant minds like you guys, foster that, grow that. And then you can then teach other people how to do that, right? But when we keep trying to fit a square peg in a round hole, we're all frustrated. People are not getting healthier. And we're not making any more money. Nope, that is not a win for anybody.
What I hear every single time is fear of getting bullied by the ADA and losing their license for not practicing in their scope of practice. So their scope of practice is only in the mouth and a little bit in the jaw and a tiny bit in the neck. That's it. So we need the regulations for these dentists and medical team members needs to have a really open dialogue and say, you have now the support of the medical community to open up your practice and look for diabetes, look for heart disease. All these like indicators are in the oral cavity that they're missing. Even on the wear on the teeth is going to change the atlas, which is the main vertebrae holding the skull, which could put pressure on the vagal nerves and shut down the brain. The dentists are right there. They should be right there involved with the medical side by side. None of this tiering,
Well, and the dental hygienist should be in every medical setting. I mean, that is my vision is yes, there is a place for dentistry, but I think dental hygienists belong in private practice alongside dentists. They belong in their own independent practice and they belong in medical practices.
Absolutely.
And so to me, a very more seamless integration would be let's get dental hygienists where they're needed most. Centers for brain health, centers for heart health, and we are the only preventive specialist that there is
in the whole healthcare industry. Yes.
Yeah. So,
nursing.
I think when dental hygienists step up and claim this role that we can do more, we deserve more, patients deserve more. That's how we're going to move the needle is I want dental hygienists embedded in every single setting there is, whether it's a gym, a tanning salon, a community center, a school. I mean, you name it.
So how can that work, Lancette? So do we need to be self-regulated? I think that's one of the first hurdles that we have to have cleared before we can move forward. That is what establishes us as a profession, period. You can't even call yourself a profession, globally speaking, unless you have self-regulating. So what does that mean exactly? In every state in the union right now, there's it's called a dental examining board generically. And those members are usually run by a dentist and some public members. And most states now, I think, also have a dental hygiene member or two sitting on that state board. And they are the ones who spank everybody who gets in trouble and helps to make some rules. California is the only state now that has an examining board or a dental hygiene examining board where they regulate themselves, where they spank themselves, where they make rules for themselves. And is that a possible thing to have happen in each state? What has to happen for that to happen?
Yeah. So, I mean, again, that goes back to policy change, right? So each state gets to determine their regulatory structure. So, for instance, in Nevada this year, there was a big super bill kind of brought forward that would change board makeup, because even our state government in Nevada realizes that the Nevada State Board of Dental Examiners has very heavy dominance of dentists. I think it's over 82% dentist dominant. So step one is we got to change board makeup, right? So in Nevada, we tried this many years ago. We've tried for self-regulation. You could try for at least equal representation. If we couldn't have our own board, which would be ideal, states could pursue equal representation. We need to change the name of dental boards. Ours is the Nevada State Board of Dental Examiners. It should be the Nevada State Board of Dentistry, Dental Hygiene, and Dental Therapy, because that's technically who they represent, right? So yes, self-regulation is the number one kind of agenda item that ADHA is working on and has been working on for well over a year now. There will be meetings and task force and hearings to look at, but it has to even go back one step farther. Dental hygiene education is controlled by the Dental Association as well, by CODA, which means dental hygienists don't have any say in what we're taught, what we're tested on, what our competencies are. And this was quite a few years ago that I learned very early on that CODA is not dental hygiene's friend, right? They took out dental hygiene diagnosis. They will not add additional things. Like right now, ADHA is also working on trying to have some myofunctional therapy put into dental hygiene education. But ADHA and dental hygienists do not control our education, dentists do. So it has to go back even one step farther of reimagining dental hygiene curriculum and accreditation. Then it needs to go to practice. That's
Right.
boards, right? And then it goes into practice settings and scope of practice and things like that. And that's where my policy making kind of thing has always come into play is we have to change it from the very beginning. And California has some really great things.
Completely agree.
Yeah, and California has some great things going on.
On our list of things to say was fake schools, because we're like all about that, the way that the schools are run. So California, sorry, go ahead.
Well, I was just gonna say, well, California is doing some really amazing trailblazing things, but then hygienists have to stay in California. Like we envision something much bigger that with true license portability, right? That hygienists can freely move across state lines and that there isn't just one entity for one state. We want this across the board. So, for 6 years now, the American Dental Hygienists Association has been working on license portability, and we have the compact, which probably by 2026, almost half of states will have true license portability. So hygienists can easily get licensing privileges without taking boards, without background checks, without thousands of dollars, without 6 or 7 month waiting periods. So once we have true license portability kind of exploding, it's going to have to drive change with scope of practice as well. Because why would one hygienist from Nevada or California, where we have very progressive, practice acts, ever want to go to South Carolina when you can't even, use a laser or give a block, injection or whatever?
Lancet, have you ever considered non-clinical dental hygiene, defining what you're talking is about, redefine or defining dental hygiene? Because the public still doesn't understand that dental hygiene has 4-year university degrees. And so what I see is the definition, defining dental hygienist with such a strong definition, and in that scope of practice that you're talking about, there's a clinical aspect and a non-clinical. I would love to go into, as a young student, if I knew I had a career option for non-clinical and I could keep growing and build my base and my knowledge and have my hands-on experience. I counted, I've been in over 40,000 mouths. So where is that clinical experience with that surgeon? She's cutting open a gut, and I've been in mouths, actually seeing what the gut does and how the mouth works with the gut, and she doesn't. She has no clue about cranial nerves. And I even said to her, I said, 50% of the cranial nerves go through the mouth, the teeth. And she looked at me with like deer in the headlights. This is a surgeon, okay? And she's young and she's in her early 30s. So I thought, we have a real divide here of the medical and the dental. And just in Nevada, Las Vegas, I'm in Las Vegas, was the first city in the country to use dentistry in a study with Stephen Thorpe. He's the medical dental, he has the dental medical software. And Stephen Thorpe, THORPE, Pacific, dental services, and diabetes. So they had this big launch in the ribbon cutting, dentistry, the dentists are going to look for diabetes and they're going to refer earlier cases to the hospitals for, treatment. Not one dental hygienist was in that setup, not one. Dentists don't look for diabetes, hygienists do. So looking at this definitive, we are the more medical minded in the dental care industry, bar none, because if I couldn't do what I'm doing had I not had my medical foundation in my dental hygiene training, just like Shirley. The 2-year graduates don't really get the anatomy, but what I see is loss of anatomy intelligence. They don't even understand the cranial nerves or anatomy that they're working with in an area that the dental hygienists don't even get it. And I didn't get it till I started talking with medical doctors that understood and were training me about it. So what I see is a real need to define who we are, our definition, so that even there's pride. The dental hygienists say, I don't have those classes, but I'm going to take them. I'm going to invest in them. And I want to be a dental hygienist, and I want to be in the medical and be shoulder to shoulder with these doctors. I go head to toe with these doctors. I'm around medical doctors all the time because the European doctors were the ones that gave me the respect. It wasn't the American doctors. It was all the foreign doctors. So what I see now is a real need in the American situation is to have our voice equilibrated with, like you said, a team. We're part of the team. We have to be. We're saving lives. we're putting information on out there that I helped one time a case when I was clinical. I said, I did extraoral and intraoral palpation. His neck was too stiff on the jugular and the carotid artery were way too stiff. I said, you go see a doctor about this. It turned out he was pre-stroke. So he was grateful that I saw it. The dentist was just looking for cavities and crowns and bridges and implants or root canals.
Stuff to make the
This is,
overhead work.
yeah, this is where I see the real need, because if Stephen Thorpe is launching this new, software, which I have invented, a dental medical software collaboration with the medical team to the database intake, how come there wasn't a dental hygienist there? Not one. It was all dentist. And I thought, that's great. Where's our representation? That's where my passion is I'm supporting you 1,000%.
Well, I've even had conversations this last year that I think we need a complete rebrand. I don't even know that we should be called dental hygienists. I mean, I think
That
the
was my question.
conversation
Yeah.
needs to happen as what is our role?
Yeah.
We do have the 7 professional roles of the dental hygienist. So dental hygiene students are taught that there are 7 professional roles. You can be an entrepreneur, you can be a researcher, you can be a clinician, whatever. We have the 7 professional roles. We have the standards of clinical practice. But I think the rebrand has to be even bigger than that. What we need to claim what we are specialists at, which is prevention. I think we need to change our education level. I'm a big proponent that we should be entry-level doctorate degrees because we are the specialist in prevention. And until we have equal degrees with our partners, we will never be thought of as equals. And as long as somebody always has a higher degree, right? So I wish that it didn't take these kinds of things, but this is what other professions have done, right? Nursing is moving to doctorate. Physical therapy is only doctorate. PAs right now are going through a massive restructuring too. They're changing their name from physician assistants to physician associates.
There you go.
Physical therapists are now considered primary care providers in many states, and they can order x-rays and things. So I mean, we are seeing this evolution and transformation. It's just, we are about 100 years behind every other profession. But again, that onus comes to us. We got to make some bold decisions. Are we willing to change our name? Are we willing to change our education level? Are we willing to take on accreditation ourselves? Are we willing to do all these things? Because I think it's all needed.
It's funny you say it about the name. I tried, and I did an experiment with the public. I said, and I worked with so many doctors over the years, medical and dental, in this field of infrared imaging and reporting. And I said, well, actually, I'm a dental medical thermographer. Okay, that's the basic technical, but I'm also a medical dental hygienist. And when everyone heard the medical dental hygienist, they go, well, got confused. So then I thought, I'll experiment. So then I said, I'm a dental medical hygienist. Oh, you're a dental medical hygienist. Wow, what is that? That's great. So you're medical. So that resonated. That came from, a worker with me on my team, dental medical hygienist, DMH. And I use that term all the time, and I separate myself. And I said, I'm a clinical dental hygienist in my foundation, went into dental medical thermography. Now I'm a dental medical hygienist. So when I talk about mouth and body connections, and I talk about postural, issues that are affecting and shutting down neurology in the body, they listen because it sounds to them like she's dental and medical. So she gets it. And that has put me in a position of authority with the public. I made it up, but
well, I have my own made up term too. When people ask me like on a plane or, oh, I'm traveling for work, what do you do? I say, actually, I'm a very elite healthcare provider who happens to specialize in the mouth.
Yeah.
There you go.
I'm an elite healthcare provider. That is what I am. I totally made that up myself, but that's how I view myself, right?
Well, what can we do to help? I would love to be part of your team and be a voice. And here in little Las Vegas now has blossomed to 3 million people. I think are you in Las Vegas or Reno? I think you're in Reno.
I'm in
right?
Reno. Yeah, I'm in Reno,
So here,
Nevada.
this city, I heard from the surgeon last night that we're fifth from the bottom of delivering the greatest well care in the world. Fifth from the
Mm.
bottom. So it's not a
Well, I haven't
great,
heard that, but I'm not surprised.
unbelievable. But you know what? There's a strong dental hygiene association, and maybe that's where we start in the local dental hygiene associations, having web study clubs or having, conversation, get to know our sisterhood. I call it dental hygiene sisterhood. Maybe that's a loose family term, but we need collaboration and support each other. And I
Mm.
don't know about you or Shirley, but when I meet another dental hygienist, we instant bond. We could be in the grocery
Yeah.
store. Oh, you know my pain. You understand it. And if they don't, then they don't care about the profession. They're there to collect the paycheck, and then we don't bond. And but more often than not, people
Yeah,
that
you find
care,
your people.
we do. Is there a way we can start in the trend, or start in the, I say trenches, but start in the local areas to help you in any way, or sponsor our meetings? I would be happy to do that here in
Well,
Las
yeah,
Vegas.
I mean, you're in Las Vegas, so that's the Southern Nevada Dental Hygienists Association. That would be a great place to start. Ask them, tell them your ideas and ask them what they need. And how can they help you share your message? How do you help them share their message? I mean, I have been an officer or on a committee for my Nevada Dental Hygienists Association for almost 30 years. So I am extremely passionate about that community, the bonding, the share of information, but also then that's what drives legislative change in your own state, right?
Wonderful.
And
Yeah.
then I'm now on the national level, kind of pushing those initiatives. But
We're so grateful for
yeah, I
your
mean,
voice. Really.
sharing messages, like I'm so grateful to just have this hour with you guys today. We need more candid conversations. We need more brainstorming. We need more ideas. You have my contact information. So, when we talk about what ADHA does on the national level, we are a member-driven organization. So the policies that we have in place come from our members, come from our House of Delegates. But
I would join gladly and pay my fee every year, and Shirley would too, but we never felt we had that
yeah,
representation
yeah.
of voice. With you, President, I wouldn't even think twice about paying my fee,
But
you know?
also just that would be awesome. I would love that. But even if you don't do that, even if you want to write a policy that you want ADHA to adopt, those come from our members. You write those and you bring them to us, and then it goes through a process of hearing and input and whatever, and then people vote on it, and then it becomes a policy. But even with the work that you're doing now with your thermography, right? We don't have a policy on that, so we lean on experts to bring those types of things forward. And we can't stay in the past, because all relationships, our marriages, our parenting, our professional association, there might be times when it's great and there might be times when it's not great. You just got to be in it for the long haul and realize that things are constantly changing. New leaders come and go. Some members are really involved and bring forward lots of great ideas. Sometimes nobody brings forward any ideas and we can't do business. So it's a constant ebb and flow. And of course, I would love you to support all the work that ADHA is doing for autonomy and advocacy and policy change. But if nothing else, bring forward your ideas and be part of the conversations, because anybody can bring forward information to ADHA.
So Lisette,
Yeah.
I didn't know that. I seriously did not know that. The last person I had contact with was Denise Bowen. And she was our program director in Idaho State University. And the first day of dental hygiene, our program there in Idaho State, she goes, "We can train a monkey to clean teeth, but we're going to train you why you're a dental hygienist." She was so driven. So when I went on this whole career option path with RDH, I said, "Denise, will you endorse what we're doing?" And I even had conversation with her, and she says, "I can't." Through the ADHA, she said, "But I can off record tell you, don't stop your path." And I thought, wow, no support from the ADHA. And I would gladly go there and to watch it. I would talk about this and say, I'm an advocate for this. And is
Well, yeah,
there,
I don't know that one person's story. I can only tell you how ADHA has always ran is by bringing forward things
uh-huh,
through the House of Delegates. That's all ADHA's work traditionally has been through the House of Delegates,
okay.
which has also it has restricted us, right? Because there are times when ideas have come forward and the House didn't pass it. Well, ADHA leadership cannot go against our membership. Now, we are looking at governance structure changes. We've been working on that for a whole year. We passed a bylaws last year that gave the board more power to move more nimbly, to make more decisions. We're continuing on that pathway of governance restructuring. So I'm hoping in this next year, we're going to see some massive changes that still allows now the board to do some more work. So when ideas do come forward, we don't have to wait a whole year. We don't have to be reliant on, a House of Delegates that may not be familiar with the issue at all. So yeah, there were some structured issues for sure, and there still is some structure issues, but we're working on those. We've implemented intern policies this year. We've changed bylaws. We've implemented new membership categories, and that's just the tip of the iceberg. There is a ton more coming. That we want open communication. We want every single hygienist to have input on what's going on, and we want to be able to make changes faster. So you bring up great points. I don't know that leader's story or why that was said, but also Shirley has seen what has happened at the House of Delegates before. And when you have people that are not necessarily in the trenches of the work that you guys are doing, they might have a harder time to understand it or embrace it or value it. We got to create a more level playing field for fresh, new, innovative ideas. And I can tell you the leadership for the last 2 years has been stellar. It has been phenomenal. It is about open communication. It is about changing the industry. It's rebranding. It's telling our story. It's medical dental integration. It's all the things that we all have a shared passion for.
How do we get a hold of, we're on a podcast, people are watching this. How will they find you? What is there a website?
Well, in your state, that's easy. Go to your local or your state association, have a meeting, talk to them, or you can reach out to me anytime, lancetv@adha.net. Pretty soon, we're going to be launching some sort of a portal on the website that's going to make it even easier for people to bring forward ideas and suggestions to us. Right now, you can still go on the website. I think the link is still up to submit policies that will be considered for the next year. So go to the ADHA website, look under House of Delegates, look under submitting policies, look at how to find your state resources, look for the advocacy toolkit that's being built up as we speak. And then just reach out to your state and local leaders, reach out to me anytime. Like, we really have to acknowledge that if we don't all step up and make some big changes, this profession could go away. And that's the last thing that any of us want. It needs to evolve, it needs to change, but we do not want it to go away.
Exactly. And that's why I think it's a really good idea to change up the name. Even just removing the word hygiene altogether is probably important.
Yeah, we do more than clean.
We do more than clean.
Some hygienists never clean.
There are other hygiene groups. There's industrial hygiene, and there's whatever all hygienes. So we don't, we just so used to calling ourselves hygienists, and so getting rid of that little part of it should be a high priority. I don't know what to do. Just like physician's assistants, when I see PA after a name, I'm like, oh, it's not really a doctor. I'm still hung up on the assistant word, even though I know better. And words matter. That was one of, I think a lot of people would get a lot of benefit and have a better mind shift if they look back in RDH magazine at my articles that I wrote about this a lot in 2003 and 2004. I just searched Gutkowski RDH magazine, and some of my older stuff came up, including, I think it was one of my first articles was, the problem's us. And we're not moving forward because we're still considered floss nags. Dentists call us floss nags. Patients call us floss nags. We had this big push at the end of 1999. Dr. Page, and I'm so sorry, I don't know his first name anymore, wrote an article in a medical publication indicating that in moderate periodontal disease, you have an open wound the size of the palm of your hand.
Oh, I remember that. Yeah.
Yeah. And they just went on, oh my God, you have to floss. You can't floss that. We learned that in school. The floss only goes down 2 millimeters or whatever. You can't get down to 5 millimeters. we were just nuts about flossing. And then the fluoride varnish came out and nobody thought about fluoride toxicity. When you're putting that heavy duty fluoride onto the teeth of these little tiny kids, that's not a single serving well. That's a 5 people well. Nobody did that extra thinking. The way that the schools are, everybody thinks, and this is what I think is the biggest problem, and I'm glad you brought it up as like an initiating problem, is that we're graduating from a 2-year degree with we're graduating with an associate's 2-year degree, although it took us 4 years, 4 years of blood, sweat, and tears, 4 years of not going to work, 4 years of having kids and then not being home for the kids because we have to go to school, all of that stuff. And then we get saddled with a technical school degree. And I've seen it happen at our legislatures where these arrogant blowhards would come up there, just a 2-year technical school degree. And this is why we need a PR campaign. We need the public to understand.
Yes.
When Angie Stone and I were deep in the armpit of going into nursing homes, we had a lot of problems just convincing ourselves it was the right thing to do. We were taught in our program, in our 2-year program, that it was illegal for us to brush our grandmother's teeth in a care facility because we were practicing dental hygiene without a dentist present. And we had to muscle through that. We were both afraid we were going to lose our license. And I said to myself, if 3 attorneys knew that we were not allowed to brush freaking teeth in a nursing home, that would put an end to this. So we tried really hard to get, some traction, got zero. We got a ton of pushback from association members. And it was, we need the public to understand that these things are happening so that they can get behind us and ask for a registered dental hygienist. The dentists have, 45 minutes of dental hygiene education in school. Do you know what the actual number is?
I don't.
55 minutes?
Yeah, right.
So then they look at us like we're too stupid to get it figured out in a half an hour,
Shirley, you're right. We had the conversation when I had the disconnect and I went on the road because I got sick in a clinical environment and I didn't put any lawsuits out there. It was radiation poisoning. I had to reinvent myself. And what I discovered when I reinvented in a non-clinical setting working with the dentist, how could I know what I know was the big pushback. Then I did my research and found out we have 2,500 hours at our graduating level of dental hygiene. The dentist has 500 hours. So no matter what,
I think that's generous, like seriously generous.
It could be. But when I worked in over 600 offices when I was in San Diego. I temped. Every day I was in a new office because I could move around and be temping. I like that better than the office politics. And they were happy to see me. Most front office people aren't happy to see us. And so what I discovered was that I was seen as 500-hour dental hygienist. And I was even fired for talking about oral systemic before it was even in the literature. The dentist fired me, said, you're talking about things that are scaring the patient. Maybe
had the same conversation.
Yeah. So I got fired. And I said, but, I was trained in this. He said, I can't. And so he would fire me, I had 4 instances. So this is where, our branding comes in and think about it, a 25, in the school I had 25 seat application with 25 seats available, 200 applications. You've got competitive women in there. They're very educated. They're very intelligent. And the ones that want to excel, then you're blocking them and they can't excel past cleaning teeth, and everything's about a new instrument or a new this, versus.
And the idea that dentistry is only necessary if dental hygiene fails. That's been proven like 1,000 times. And that we're still in this second chair situation is a crime. And that is why I'm going to ask you now, is it because we're girls? Is that what got in the way?
100%.
Oh, no.
I mean, I personally believe, yes, we have, the male dominance,
Oh,
and
boy, oh,
just the
boy.
women in the workforce anyways. We carry the brunt of family responsibilities. We have to take time off, to recover from having a baby. We need to pump and breastfeed our babies. And yeah, I definitely think plays a huge role in why we haven't been able to elevate, at the rate that I think we would like.
And I know that you have policies at ADHA, and all the states have policies. They are not available to the rank and file regular people. If somebody was writing an article for the Wisconsin State Journal, they wouldn't have access to the policies. I was sniffing around there, whatever, I don't know what I was looking for at your website, and I was like, this is really hard, and everything looks like it's locked. So
Well, I know our intern policies are on there. I'm so sorry, I have not been on the
Yeah.
website
Why would you
recently
know,
because
right?
that's not where I
know
get
what
my
they are. You have
information.
access, right?
But if you
So,
scroll all the way down to the bottom of the homepage,
mhm.
you will see newsroom, and under newsroom is all the things that have been newsworthy probably this whole entire last year. That's a really great place to find information, and that tab is new this
Okay,
year.
well, there you go.
And it's at the bottom, so you have to scroll all the way down to the bottom. So these are all things that we have been talking about. We're building a new advocacy portal that's going to be open and have some interactive things. Now the policies and bylaws, I think if you click on that, right here is where you should be able
Can
to.
you share a screen or can we see it? Because as you're talking about it, I think this would be
If
super
you have it
important.
open, Lancet, go ahead. You can share from.
Okay, let's see. Oh, share.
And that said, I have a quick question. Are you
Yeah.
guys throwing around some name changes ideas? I'm curious.
We have on the agenda for fall our strategic planning, and strategic planning is going to be looking at all kinds of things, right?
Uh-huh.
Are you able to? Okay,
Yeah,
so
We can
strategic
hear.
planning happens in the fall, and that's when we will be having lots of big discussions about where are we, what's going on. We're doing an environmental scan right now, which will be looking at, healthcare in general, looking at the dental landscape, looking at legislation, looking at what are our next efforts that we need to do to pursue autonomy. So that's just something, yes, that I have planned on wanting to have a conversation about, but we have not had an organized conversation about that yet. It's on my agenda to have. Okay, so I'm now here. Can you see ADHA?
Yep.
I'll go back to
Yes,
this
great.
is the homepage right here. If you scroll all the way down to the bottom of the page, here you'll see the newsroom tab.
Okay.
And the newsroom is going to be all of the things that we have been working on, all of our letters. You'll go down and you'll see our intern policies, work we've done with the CDC, the Delta Dental Foundation, testimony, accreditation standards, local anesthesia. So that's just high level stuff that we've been working on.
What about the
So
local, Lancet? Now I want to get a hold of my local. Is it listed here? Who I can, how her information or their information?
most likely, but it probably would just be easier to just every state has their own association. So Nevada Dental Hygienists Association,
Right,
and
but
there
can
you'll
we,
find
it's not on this website then, all the
it
states?
might be. I'm just saying that I don't go here for my information. So
Okay, okay.
I would peruse that. You probably, yes, can find and connect your local chapter, but
You can just Google it. It's easier to
Well,
Google
but
it
I'm
than to
just saying,
sniff
oh,
around. Yeah.
because we make it simple, make it easy, easy access for dental hygienists to go here. Here's the umbrella. And this is where you're going to drive traffic for them to read about the regulations and all about you and your work. They get excited. That's where I see that. And then they find their local.
Yeah, and it probably, again, is probably on here. There
Yeah.
is so much on here. The top has a tab, has two different tabs on the top. The bottom has a whole bunch of different tabs. And this is constantly changing. Like I said, right now we are focusing on trying to create what's a good system for people to communicate their ideas with us. So I don't think that's on here yet, but that's coming.
How do we change these policies that ADHA supports into law? That is the other piece. And that's the other thing that I think that the consumers need to know what these are, so that they can, these dentists are playing golf with the legislators. I don't care what the lobbyists are doing, but we need the public to also understand what these policies are. Who cares? The ADHA has had a policy for entry level as a baccalaureate degree for decades. The three of us have bachelor's degrees, but 99% or whatever are saddled with, hold on, let me finish this now. They're saddled with this associate degree. This is what I put on a YouTube video years ago. This is what you need to do while you're on hold, when you're waiting to get into your program for those 2 years. You take your classes, your prerequisites at a university that'll transfer in, and that will accept your credits from the school. So Marquette University took my hygiene credits. University of Wisconsin-Madison would not. So had I taken my prereqs at even Upper Iowa University, we had a wing here in Madison. If you took those classes first, transferred those into the technical college, and then transferred the others, then the technical school credits into this university, you would graduate with both in 4 years. You would have 2 degrees in 4 years. That to me makes the only way that it is right now to make sense while we're waiting for change. But that has to come from the technical school. You need these prereqs, go over to the university, take these classes, transfer them in 2 years when you get in, then you graduate, you take, 1 more class at the university at the same time to keep your whatever cogent, and then graduate with a bachelor's degree and use the associate's degree to get your license. And then start putting it, the end point, whatever that's called, Shirley Gutkowski, RDH, that's a license. BSDH is not a license. It's not appropriate at the end of your signature. MD is appropriate. PhD is appropriate. But for the most part, it's kind of frowned upon to put BSDH after, or just BS or whatever all. So I think that that simple shift we can make right away. All of these directors of all of these programs have no shackles to keep those 90 credits or whatever's 60 credits, those 2 years of credits in their school. They can recommend that they go to a school that's going to accept all the credits. So I think that would be a super fast way to get a lot of baccalaureate degree hygienists out into the world. The thing about a baccalaureate degree, and this is what they told us at the time when I was looking into it, they're like, well, they're just like sociology and then all these other kind of classes that don't pertain exactly to the practice of clinical dental hygiene, but they teach you how to think and why to think, and have critical thinking skills that you may or may not have time to learn in the associate program, because you have to learn to take the exam. The exam is critical because it's made by the American Dental Association, and that's who is overseeing all of our licensing. So I wanted to get that piece said. So that's,
can I talk about Nevada just a little bit, about what happened recently with the legislation and where policies and degrees matter? Because this is my own home state, practicing hygienist here, right? I've been a registered lobbyist here for 30 years. I have written lots of bills that have advanced the scope of practice here. But what happened in Nevada was so interesting. And the Dental Association has met with ADHA several times, before, and they have a very clear agenda that everything that dental hygienists do is on the job trainable. So when we started seeing these bills come forward with dental assistants scaling teeth, we were concerned because it was just above the gum line. We're not addressing root causes of disease. We're not critically thinking, right? It's just scraping tartar that we know is not even really therapeutic above the gum line. But then in Nevada, that evolved. That bill died. We killed it. The Nevada Dental Hygienists Association worked very hard and killed that bill. Then comes forward the next bill that would just be Joe Smo off the street can be on the job trained. You didn't have to be a dental assistant. You would not be called a dental assistant. You would be called a licensed dental hygienist. So that whole like look for the license tagline doesn't work in Nevada, because this would have been a licensed dental hygienist on the job trained, and the competency exam would be given by the supervising dentist. So no college education, no boards, no dental assisting.
What a
So
disaster.
how were we
Yeah.
able to stop that? That was the Nevada Dental Hygienists Association and the ADHA, and we used all of those policies. Those policies are used. It's not the dentist, it's the dental association and it's the hygiene association that influence policy. It's the associations. And we use those policies tremendously over and over and over again. But also in Nevada, there is no associate's degrees. There's only bachelor's degrees for dental hygienists. And that came from the association. The association determined years ago that we were not going to accept associate's degrees. And so then we worked with the program directors. The program directors did all the work, but we initiated that based on ADHA policies, that this is going to be entry level. So this is the standard for our profession, comes from ADHA policies. And then it's up to the states to decide what they're going to do with it. And some states have chosen not to do that, but Nevada did. So how we were able to kind of make that bill not pass is like, we are bachelor's degree dental hygienists and policies do matter. And it was face-to-face meetings with the associations and lawmakers that prevented that bill from passing. So policies and degrees matter a ton.
So
I agree with
was the dental association in on those meetings?
Initially all together, and then things got very contentious and they were separate.
Okay, because that's
Yep.
what was happening here way back when I
Yep.
was president, that every time the dental association was in there, they would get all bossy and
do.
and change their tune. You know, we'd have meetings with them originally, and then they'd come to the legislative meetings, and then everybody would be like, what happened?
100%. That's exactly what happened here too. Mhm.
Yeah, and what I hear is they're not thinking win-win. They're thinking win-loss, and there's power play. If you go to the root cause, every single time it's going to be about money and it's going to be about production. Could the dental hygienist take away their patient base, go into another area and pull all their income out of their business? That threat is very, very real.
You're 100% right.
And so what I see when we go into these policies, and I know we're not, there's politics and then there's business, but really, I don't see a change until the dentists look at us and say, wow, it's win-win. When we work with them, we're going to be income coming in way more than we've ever had. And then we have a rebranding and a restructure. It's like, every business that's smart, I mean, McDonald's is now selling breakfast burritos, and burritos were only in taco shops, and so, and I see now at Walmart, Mercedes-Benz, and Rolls-Royce is coming because they shifted, they sell organic and they sell fresh, where is the business in the dental world? And that's why I believe they panic. They panic because they're not good businessmen. If they saw the potential income from our rebranding and what we're partnering with, we would have referral sources from maybe 5 or 6 other areas coming into their business and increasing their business and increasing their bottom line. And that to me has been the conversation every single time I go in to do a consultation with the dentist. And the fear is I have to change and I'm going to lose money. That if we can overcome that, I have to change. By changing, I'm going to lose income because she's not cleaning teeth. She's doing, infrared scanning to find, postural issues that I could fix if I were trained. I mean, there's just so many business potential in this whole structure that I see that they are not aware of. I would come with a flow chart and say, Dr. Dennis, look at your income structure now, drill, fill, bill. Now let's look at a rebranded dental hygienist that has the brand, and the certification or the licensing and training, and look at the income stream. You would sit there, they would open their mouths, would drop going, really?
Victoria, we're after an hour.
Actually,
So
we started at 11. We started at 10:05.
yeah, so still, but we do need to kind of finish up here. Lancette was generous enough with her time to come out here for an hour. So any other closing comments, Lancette?
Well, I think we need to have way more of
Yeah.
these conversations. We need to have
Yeah.
bigger conversations. We need to have back and forth dialogue. Support your professional hygiene associations if you really want to support autonomy. That is what ADHA is working on. I have my own podcast, Beyond Breathing. If you want to
Oh,
listen to my own podcast, or be on the podcast, if you guys, I'd love to invite you to be on the podcast.
Sure.
I'd love to invite you to write articles to ADHA. We have a new portal there called Hygienist Hub. So
Oh,
please write your articles and support them. We would love that. So, submit your ideas for new policies, get involved in the change process, and know that you have so many people cheering you guys on. You're doing amazing work. And
wow,
thank you for being trailblazers and change makers, because it is hard. It is not easy. We keep saying the same thing over and over and over. I think all of us for at least 30 years.
yeah,
But
for
I
real.
do believe that what is happening now in organized dentistry, and this attack on hygienists, I think it's what I call it. I think it's the best thing that could have happened. I think it is exactly what needed to happen, or things would have never changed, and we'd be doing the same things the same way. And me as a hygienist right now, when I go into my private practice, cleaning teeth is the least of my priorities during my 60 or 70-minute appointments. And if I go through a whole hygiene appointment and do not clean their teeth, but I counseled them on diet or nutrition, screened them for sleep apnea, referred them to a myofunctional therapist, got their, connected with a cardiologist. I feel like that is literally changing and saving lives. And there's always time to clean people's teeth. It doesn't always have to be the most important thing that we do. And I honestly think it's the least important thing I do as a hygienist now.
amen. Amen.
For sure. So Victoria, what do you got to say for little closing comments here?
Well, in that respect, I wrote and coded, and with the help of the dental hygiene, dental medical software that dental hygienists can use to have autonomy and collect and I guess highlight their knowledge. And when I show this to dentists, they're in shock that I know this. So I think having the one of the changes and wrapping it up is I designed a software to show the dentist visually in a report, like you just said, Lancet, what we know and how much we can fact find and collect database to help bridge that gap with the surgeon to say, surgeon, did you know this person has a gut problem because they're drinking this, or their diet is this, or they're stressed at home and they're in a bad marriage? I mean, there's so many factors that we have access to collecting information. Nobody else in the whole world in the industry does.
Where can she learn more about it on your website? Because did you change the name of the website just recently?
No, it's not Tangram was a puzzle mapping Chinese name that I use, and it wasn't clicking with anybody. So I went to Dental Medical Thermography at dmtscans.com. And then the other website that's what we're talking about is Dr. Links, DRLINXS.com. And I have the hygienist right there with all the doctors, shoulder to shoulder. So drlinks.com is the collaboration for pulling us all together, using the software as an indicator reporting. Yeah.
Sweet. So this was a lot of fun. Thank you so much, Lancette. This is Shirley Gutkowski of primalair.com. Get my website in there too. And it's just so fun to talk to so many people that have so many hats and that are enjoying their life's work.
So once again, Shirley, where Lancet can we find you and contact you?
You can email me at lancetv@adha.net. You can find my podcast, Beyond Breathing, at pretty much any platform. I'm on LinkedIn, social media. Happy to connect anyway. Lancet Van Gilder.
That's awesome.
Have a great rest of your day, everybody, and we'll see you next week. Please
All right.
subscribe and do all the stuff that other people want you to do too. So